Good evening, and welcome to All About Us Radios, where we're empowering women. I'm Dr. Monique DeFord Jones, and we are in Black History Month. And I want to thank everybody, and I want to make sure that we can celebrate all of our growth. Tonight, I have a special guest, Dr. Jacqueline Ford, who's going to speak to us on cervical cancer. Dr. Ford was born in Jamaica, West Indies, and graduated from Stony Brook University, and she received her medical degree from the Albert Einstein College of Medicine in New York. She completed her residency at St. Luke's Roosevelt in Manhattan, and in early 90s, she was employed by Brookdale Hospital and also had a private practice at that time. Then she became the associate assistant medical director for the New York City Department of Health Bureau on Sexually Transmitted Disease Control. And followed by 8 years, she was then the director of patient safety officer program at NYU Langone. And finally, for the last 2.5 years, was down at New York City Health and Hospital. Dr. Ford recently completed a clinical quality fellowship program, which is co led by the United Hospital Fund and the Greater New York Hospital Associates. Her focus is currently on patient safety and quality in obstetrics and is interested in reducing mortality both locally as well as globally and helping to reach the World Health Organization's goal of a cervical cancer free future. I want to introduce you this evening to Dr. Jacqueline Ford. Dr. Ford, welcome to our show this evening.
Thank you so much, Dr. DeFord Jones. It's quite an honor and a privilege to participate in this program, and thank you for having me.
Oh, thank you. I know that cervical cancer is back on the rise, and this is Heart Health Month, and for the month of February, we wanted to focus on women and health. So I wanted to focus on cervical cancer since it is back on the rise, and I know it's an area that you're passionate about. So, Dr. Ford, what is cervical cancer?
Thank you so much for asking. And I will say that just as this is Black History Month, January was actually Cervical Cancer Awareness Month. So the timing of having this talk, I think, is very pertinent. So I'll just talk a little bit in general about cancer first. So cancer is really the excessive or overgrowth of the cells in a particular area of the body. Our body is made up of trillions of cells, and typically the cells undergo a process whereby as they age or they may become damaged, they'll end up dying and new cells will form and replace those cells that have been removed. However, when that process is affected or damaged such that the development of the new cells is altered and the damaged cells continue to grow, this leads to the excessive growth of abnormal cells. And this is what we call cancer. And cancer is named for the part of the body where it originates. So, for our discussion today, when the cells in the cervix of the woman's body, which is the mouth of the womb or the opening of the uterus, when those cells, abnormal in appearance, continue to grow when they should have died off, this leads to what we call cancer. Those cells can continue to grow and invade locally to tissues that are in the area, that is the upper vagina or other areas and organs around the womb and the cervix. Or those cells can actually spread to other areas of the body or metastasize. They can go to the brain, to the liver, to the lung, etc. And you had mentioned that cervical cancer it's a cancer that is definitely on the rise and more so globally than here locally in the United States. So globally, cervical cancer is the number one cancer killer of women. Every year, 250,000 women die of cervical cancer. Here in the United States, we diagnose about between 14,000 to 15,000 women each year with cervical cancer, and approximately 4,000 or 4,200 will die each year here in the US from cervical cancer.
That's an astounding number. But, how do you diagnose cervical cancer? What are some of the things you do to diagnose cervical cancer, Dr. Ford?
So that's a great question. So cervical cancer is caused by a virus called the human papillomavirus. And this virus leads to abnormal changes within the cell. So that cells that have abnormal structures within them that should have died off continue to multiply and divide. And this is because of the virus that's present in the cells. Those abnormal changes, we can actually identify those abnormal changes through pap smear screening or through HPV testing. So the pap smear is a screening test. It doesn't give us a diagnosis, but it allows us to screen women or look for women who don't have any signs or symptoms of cancer, but we evaluate their cervix by using a brush, taking samples of the cells of the cervix, sending that to the laboratory, and then that's evaluated by the lab, and the lab will tell us if any of the cells from the woman's cervix are abnormal in appearance. If they are found to be abnormal, that's when we report back to our patient that your pap smear has some changes which are concerning, and then we would need to do additional testing to identify exactly what the true abnormality is, and then determine what type of further testing is needed. And then from that, those biopsies, we'd be able to tell what type of treatment would be needed.
Dr. Ford, so when is it recommended that a female go and have a pap smear done? At what age?
Currently, our guidelines are that we start doing pap smears at the age of 21. So, although women may be sexually active prior to the age of 21, the likelihood of a young person in that age group developing cancer of the cervix is so low that the risk of doing those procedures and do not provide any real benefit for such young people. So we start doing pap smears at age 21. And our goal is to, for the woman who's at average risk, we would stop doing pap smears at age 65. So once they reach age 65, if the woman has been adequately screened, and if it's okay, I can talk about the screening, if that's okay to talk about that now. So we mentioned that we start at age 21. So between the ages of 21 to 29, it's recommended that women undergo a pap smear once every 3 years. Once they reach age 30, between the ages of 30 to 65, the woman is recommended to have either a pap smear every 3 years, just like you can when you're younger, or you can opt to have a pap smear and an HPV co-testing, that is both tests done once every 5 years. Or as of last year, the FDA approved that we can simply do an HPV test alone once every 5 years. So that is, again, between the ages of 30 and 65. So the provider can always discuss the options with each of the patients. And as as a woman, we're empowering you with this knowledge so that you can ask and talk to your provider about what are the benefits and risks of either one. But right now, the majority of providers do both a pap smear and a high-risk HPV test. And when both of those come back as negative, the woman does not need another pap smear screen for another 5 years. This does not mean that a woman doesn't need her routine annual check. She still needs to go to her doctor for her yearly checkup, but they just will not be collecting a pap smear or an HPV. But certainly other things need to be assessed during that time period. And then when a woman reaches age 65, If a woman has been adequately screened in the 10 years prior, then and she's been negative during those 10 years, then she does not need any further HPV or pap smear testing. However, if she is high risk in any way, that is, she may not have been adequately screened, she hasn't had a pap smear in the past 7 years, and she's now 66, well, she would still need to get a pap smear done because she is not adequately screened. If she's high risk in any way, very low immune system, new partner, things of that sort, putting her at risk for HPV, then she may need continued screening. Or if she has had a history of a high risk lesion, such as severe precancerous changes of the cervix or cancer of the cervix, then her screening regimen is going to be quite different and she would need ongoing screening. So it's only the low risk women who have been well screened can stop their pap smear tests as of age 65.
Interesting, Dr. Ford, you talked about risk. What type of women are at risk for developing cervical cancer?
Again, that's such a very good question. So, as we said, cervical cancer is caused by a virus that infects the cells of the cervix and making those cells grow out of control and allowing them to spread to other areas of the body. We know that the vast majority of women will actually acquire HPV or the human papillomavirus at some point in their lifetime. It's estimated that 80% of women will have acquired HPV by the time they turn age 50. However, the vast majority of women will not develop cancer of the cervix. And this is because the body's immune system, the body's natural ability to fight off infections, usually will be able to keep the HPV infection under control and actually eliminate the HPV from the woman's system. However, for women, as you mentioned, who are at higher risk, whose immune systems are not able to fight the infection as well, or for other reasons are higher risk, which we'll talk about, uh, the combination of the HPV present along with these additional risk factors will make the woman at increased risk. One of them is a big one is cigarette smoking. So cigarette smoking actually reduces the body's natural ability to fight off infections, especially the HPV infection. And so we know that long-term cigarette smokers are at much higher risk for developing cancer of the cervix. So it's more likely that if they've been exposed to the high risk HPV that's cancer causing, that it will persist in their cervix and can over time change from these atypical changes to mild changes to moderate changes to severe changes and then cancer over the years. Other risk factors include disease processes such as HIV, which also suppresses the person's immune system and their ability to fight off infections. Women who have undergone transplant, organ transplant for various reasons, and they've gotten a new kidney and they're put on medication to keep their body from rejecting this foreign organ that's been put in them, those steroids will suppress the body's natural immunity as well and put the woman at increased risk for developing cervical cancer. So outside of those immunosuppression and cigarette smoking, we have individuals who have higher levels of estrogen in their system for longer time periods. And that's women who use the oral contraceptive pill for more than 5 years are at increased risk, as well as women who've had several children, 3 or more children, are at higher risk for developing cervical cancer. And this, we believe, is because of the exposure, the higher levels of estrogen in the women's system, whether it's from the birth control pill or whether it's from the pregnancy itself, affects the outer portion of the cervix. And the outer portion of the cervix is now more susceptible to HPV infection and transformation into a precancerous stage. When a woman stops the oral contraceptive use after several years, that risk goes back down to average.
So as we see younger people, because again, some of our younger people are starting to have sex earlier. This could be concerning and putting them at risk for infection to HPV, hence leading to cervical cancer. Also, some people are going on oral contraception, birth control pills, higher estrogen, due for medical reasons, dysfunctional uterine bleeding, migraines, different things of the sort. How do we counsel? How do we um, talk to the patients early on so that they understand risks later on with respect? How do you balance that?
Great question. So just I will add, as you mentioned about earlier ages of intercourse, is also a risk factor, as well as multiple partners is a risk factor. So some of the ways that can be offset, whether one is using the oral contraceptive pill or at higher risk because of high dose steroids for whatever reason, or if someone is immunocompromised from HIV, etc., then there's an opportunity to use barrier protection, such as a condom. So even though a woman might be on the OCP, that might be the ideal form of birth control for that particular woman. It's working well to prevent unwanted pregnancies. Then that woman has the opportunity to use a barrier method along with it to minimize her risk of acquiring HPV. So even though she might be at higher risk because of the medication that she's on or her own health challenge, she can still mitigate that risk by utilizing the condoms. Certainly, abstinence in and of itself would reduce a woman's risk to zero, but that's not realistic for most. But certainly limiting the number of new sexual partners when sexually active, minimizing that exposure, and improving your health in general. Minimizing your exposure. If you're not a cigarette smoker, that's excellent. Minimizing your exposure to secondhand smoke. My apologies if you're hearing the phone ring in the background. Sorry about that.
That's okay.
Mhm.
So, two things you made mention about decreasing risk. How do we counsel? And tell me what your thoughts are on the HPV vaccine. The recommendation for HPV vaccine, the human papillomavirus vaccine, for young women as well as men, because again, it's men who are infecting women with the HPV virus. Um, what are some of your thoughts regarding that? And at what age do you think um, people should start getting it?
Yeah, absolutely, absolutely. So the two biggest protectors in terms of prevention is HPV vaccination and screening. So as you mentioned, the HPV vaccine is approved for use starting from the age of 9. It is recommended that young women and men, so women and boys, sorry, young girls and boys between the ages of 9 and 15 should get 2 doses at least 6 months apart. And then young individuals, male, female, between the ages of 16 to 26 should get three shots, day 1, 2 months, and 6 months. It has recently been approved up to age 45. So although it's FDA approved up to age 45, it is not recommended for everybody to get it between the ages of 27 and 45. The recommendation is that you individualize that discussion with your healthcare provider and identify your particular risk. The thought process is that by the time you're in your late 20s, the majority of people have already had significant exposure to HPV, and the benefit of the vaccine may not be as great. So certainly the goal of having it available to boys and girls is that once the vaccine is given prior to the onset of sexual activity, then the likelihood of an individual ever having an abnormal pap smear or being at risk for cervical cancer is significantly eliminated. The HPV vaccine, as we talked a little bit about HPV or the human papillomavirus, there are 100, well, it's actually more than 200 different types and about 30 to 40 that infect the genital region. And of those, about half of them, about 20 of them are cancer causing. The vaccine that we have is one that protects against 9 of the 20 cancer causing types. Those 9 cover approximately 90% of the types of viruses, HPV viruses, that cause cervical cancer. So for an individual to get the vaccine at a young age, it will protect them from getting cervical cancer at least 90% of the time. Because that 10% is still there, it's required that we all still undergo pap smear screening. And so screening is our next step. So vaccination, as you pointed out, for both male and female is so vital. So the HPV virus is transmitted primarily sexually. It can be through oral sex, it can be through vaginal sex, it can be through anal intercourse, it can be through non-penetrative intercourse, so just skin-to-skin contact. And so it's very important that both male and female get vaccinated so that we can have that herd immunity that everybody's heard spoken about with COVID-19 vaccination. But the more people in the population that get vaccinated, the less virus there is to spread anywhere. And so even those who are unvaccinated, it's less likely for them to get the disease. And here in the United States, the rate of cervical cancer or deaths from cervical cancer has actually decreased by 50% in the last 30 years. And that is primarily because of the screening that we've had. And now since 2006, we've had the HPV vaccine, which has been a tremendous addition.
So I have another question for you. And that question is this. Is cervical cancer hereditary? That's one of the questions that a lot of people want to know. And I know that you talked about HPV, but I know people are concerned. Can I get it if my mom had it or a sister had it? Those are some of the things that, come up when people are asking about cancer in general. So is cervical cancer hereditary, Dr. Ford?
Very good question. No, and that is the good news, that cervical cancer is not hereditary. There has been no gene that has been identified that's passed from one generation to the next that increases a woman's risk for developing cancer of the cervix. 99.7% of cancers have been linked to HPV as the causative agent. When it comes to a family history of cervical cancer, there is some data to support the fact that if a mother had it, there might be a slight increased risk, but it's not related to any type of genetic predisposition. They don't have clarity on what that might be related to, but there is no known genetic predisposition. The one thing that we can say is that if a woman used the medication diethylstilbestrol, which is a medication that was available, taken off the market back in 1971, it was a fake estrogen or synthetic estrogen given to women while they were pregnant to help reduce their risk of miscarriage or preterm birth. That medication is known, if the mother was using that medication while carrying her daughter in utero, that daughter who's now birthed is at increased risk for developing cancer of the cervix. But that is not because of a genetic predisposition. It is because of an environmental toxin that the mother ingested. Again, that is no longer on the market, but those women from the early 1970s or 1960s are now in their in their early 50s or mid 50s, and certainly are still at risk for developing cancer of the cervix. And that's one of the things that we as OBGYNs would ask if they know of any exposure that their mother may have utilized while they were in utero.
Excellent. That, I mean, that's an important part because I know people are always concerned about that type of a situation. Can I get it if my mother had it or my sister had it? Another question that always comes up is cervical cancer curable?
Mhm. The good news is that cervical cancer is curable if it is found in its early stages. Once it gets to an advanced stage where it's spread to significant areas of the body, it is not oftentimes the 5-year survival rate um, is less than 50%, is maybe less than 20%. So the goal is to screen, identify before it turns into cancer, and treat so that the woman never develops cancer. And if she were to develop cancer, the goal is that, again, through screening, we would identify that early on so that we catch them in the earlier stages. As long as we can identify them early, we're able to provide adequate treatment. So even if a woman has cervical cancer, but it has not spread as yet, if it's confined just to her cervix, sometimes just cutting out a portion of the cervix or doing what's called a hysterectomy, where you remove the uterus with the mouth of the womb or the cervix, that can cure the woman of the cervical cancer. She would certainly be followed through screening by her cancer doctor or oncologist to make sure that there's no recurrence. But typically the cure rate is well over 90%.
And Dr. Ford, you also said if picked up in early stages, it is usually curable, which is great. Now, if it's picked up in the mid to late stages, are there other ways of treatment besides hysterectomy that can be offered to patients?
Yes, absolutely. So there are 4 stages of disease that we have when it comes to cancer of the cervix. So stage 1 is considered to be confined just to the cervix, and early stage 1 disease, we're able to do that simple hysterectomy. As the disease progresses to a little bit more spread or a little bit more invasion of those abnormal cells, and the risk of it spreading, then in stage 2 to early stage 3, we offer what's called a more comprehensive hysterectomy. We call it a radical hysterectomy, where more of the tissue is removed around the womb and the portion of the vagina, as well as radiation therapy. So radiation is where the X-ray beams at high doses can be used to destroy the abnormal tissue or the cancer cells, and that would be locally in the area where the cancer is located. Once the cancer has spread, we're talking about late stage 3 or stage 4 disease, where it's spread to different areas of the body. Then it's typically with chemotherapy, and there might be radiation that might be offered in terms of what we call palliative care, when the disease is already spread so far and it's limited options. So we have the option of the chemoradiation for depending on what the goals are within those patients where it's already quite far gone.
Understood. Dr. Ford, another important question that sometimes comes up is if a person has had cervical cancer before, does that prevent them from getting pregnant in the future?
A very good question. If their cervical cancer were treated conservatively and just a portion of the cervix was removed, then certainly that individual can still conceive naturally and still carry their own pregnancy. Anytime a procedure is done to the cervix, there's that slight increased risk of the cervix not necessarily holding the pregnancy as well as it ought. That happens in a small percentage of patients, maybe 5% or so. And if that were to happen, that is also treatable, where the woman could have a stitch put in her cervix to keep the cervix shut tightly to reduce her risk of miscarriage. So most definitely, one can still conceive if they've had more conservative type treatment. And even in later stages, that discussion can be had with the cancer doctor or oncologist to determine what would be the right treatment and when, if they want to undergo radiation and some degree of sparing so that they can conceive first.
Okay. Dr. Ford, we're going to take a very short break and come back.
Okay. Thank you.
Hello, this is Najesti from Butter Me Essentials Natural Hair and Body Company. We are located in Brooklyn, New York. We are a family-owned company, which is run by my husband Vaden and I. Do you have hair that is hard to manage? Having trouble with hair growth? Is your skin always dry? No problem. Butter Me Essentials is here with the solution. We specialize in hair butters, pomades, hair elixirs, shampoos, conditioners, luxury soaps, body butters, lotion bars, perfumes, scrubs, and so much more. All of our products is made with natural and organic ingredients such as shea butter, cocoa butter, mango butter, Jamaican black castor oil, avocado oil, Oregon oil, and essential oils. There is no sulfates, petroleum, mineral oils, or parabens, just all natural goodness. If you would like to order our products, check out our website at buttermeessentials.com, buttermeessentials.com, or call 646-524-3351, 646-524-3351. Check us out on Facebook and Instagram. Remember, like our motto says, you deserve to be buttered.
Dr. Ford, welcome back.
Thank you.
One of the things that we didn't touch on are what are some of the symptoms and signs of cervical cancer? So when we have our patients, what are some of the signs and symptoms that patients should be looking for?
So that's a very good question. Early on, in the early stages, certainly in the precancerous stages, there are no symptoms. That's when a woman just has mild changes of her pap smear, mild, moderate, or severe changes prior to it turning into cancer. There are no symptoms. Once the woman does develop cancer of the cervix, in the early stages, the woman may still remain without any type of symptoms. As the cancer continues to grow and invades different portions of the cervix, the texture of the cervix may change, causing it to bleed more easily. So one of the most common symptoms that a woman may have might be bleeding after sexual activity. We call that postcoital bleeding. The woman may also have abnormal or irregular bleeding when she's not on her regular menstrual cycle. In addition, in the later stages, a woman may experience profuse or ongoing vaginal discharge. Sometimes the discharge can be malodorous in nature, that is, have a foul type of smell. In addition, again, as the disease process continues to advance and spread into the various body parts, if it were to spread to the bladder or to the rectum, it could lead to blood in the urine, painful urination, could lead to blood in the stool. As it spreads to the sides of, from the uterus out to the side of the woman's side walls, it could invade and lead to bone pain in the pelvis. It could spread into the back to the nerves, to the nerve roots, and lead to sciatic pain, that's severe pain in the bones and going down the legs. This pain can be excruciating in nature. And unfortunately, sometimes this is what we see in women with very advanced disease.
What would be some questions you would recommend that a patient going to a gynecologist ask their doctor regarding cervical cancer and cervical screening?
Well, I would say the most important question is to find out from your provider, when was the last time I was screened for cervical cancer and what were my results? Confirming that your test, whether it was a pap smear alone or pap smear with HPV testing, confirming that those tests were in fact negative, and understanding with that provider, depending on what test was done, when is my next screen due? Understanding and knowing that, one should then ask about, how can I minimize my risk for getting cervical cancer? Am I in the age group where you would recommend that I get the HPV vaccine? And if you are in that age group where you're 26 years or younger, it's absolutely yes. If you have not completed it, then it should be done. And if you are above the age of 26, then that's a discussion that you should definitely ask your provider. Now that it's approved for women in my age group, I'm 35, let's say, or 38, and I may have a new partner in the, or et cetera, discuss your risk, your sexual activity with your provider, and identify whether or not you're a candidate to get the vaccine, even though you're above the age of 26. Those are two of the primary things to definitely speak about. Younger women, certainly the opportunities there to talk about protection, condoms, sexual activity. We also know that other STDs can put a woman at higher risk for developing cervical cancer as well, because of the effects that they have on the cervix, such as chlamydia. So just protecting yourself and talking about your particular risk and the prevention strategies that they would recommend for you.
Before we go to questions, what takeaway would you say? I'm going to break this into different age ranges. What takeaway would you say to somebody that's within the high school age range? What would you want them to remember from this podcast?
Number one, that if they are not HPV vaccinated, they need to schedule an appointment with their pediatrician. If they're still in the pediatric age group. If they're seeing a gynecologist, then they can schedule the appointment with their gynecologist. And if they're not HPV vaccinated, they need to become vaccinated. If they started the vaccine series and have not completed it, then they should make sure that they schedule with their provider to complete that vaccination series. And number two, if they are sexually active, and they're in the age range where screening should have occurred already, that is age 21 years or above, Okay, you said with the high school, the younger age group. So
I'm going to break it up.
yes. So to STDs, to be checked for other STDs and appropriately treated if an individual is having unprotected intercourse, certainly to make sure that you're appropriately screened and treated for that, and make sure that you're vaccinated for HPV.
So my next age range is going to be 21, the legal age, and toward 29. Let's go into that because that's that real major dating age range, right? So, what would you say to that audience?
I would say the main takeaway, number one, is again, HPV vaccination is key. And so, for an individual who's starting their vaccine series at age 21, you're going to need to get the 3 doses of the vaccine. If you started your vaccine series and have not completed it, now is the time to make that appointment with your provider and complete that vaccine series. In addition, again, have you been screened? Is your screening up to date? What were your results? Was there an abnormality that was not, if you did not follow back up or you're not sure about what your results were, you need to just contact your provider, confirm that you were adequately screened and that your results were negative. And then if you're an individual who is a smoker, whether you're in the high school age group or older, need to speak to your provider, usually your primary care doctor or any of your providers, about smoking cessation. Smoking leads to so many different type of cancers, especially the lung cancer, but smoking increases significantly the woman's risk of cervical cancer. So that's an easy one to be able to reduce.
All right. And before we go to some other questions, the question that I want to put out there for you is this. If there is anything that you think we could do to make a change globally, what would that factor be? You talked about the statistics of how it is one of the number one causative factor, globally. What could we do to make an impact?
That's a great question. And I think the World Health Organization has been working with the leadership of the low-income countries to have access to the treatment methodologies that we already know work, such as screening, treating in the early stages or even prior to cancer being formed, as well as vaccination. So to be able to have a movement to help the pharmaceutical companies who are making these vaccines make them available on a massive scale, similar to the issues that we have with vaccinating individuals for COVID-19 in low and middle income countries, those are some of the same challenges that we continue to have with providing HPV vaccination on a global scale. So having the resources on the ground, the healthcare infrastructure that's needed to provide the type of follow-up and treatment that's needed. One of the things that our society here, the American Society for Colposcopy and Cervical Pathology, that helps to make the guidelines for how we evaluate women with abnormal pap smear findings and treat them, they are participating actively in going to low and middle income countries to assist in what we call the see and treat methodology. So these are some of the types of things that we don't necessarily have to do here in the US, but we found those are more effective ways so that the patient only has to come for one visit, and we can, using the same solutions that we use here in the US, it's called acetic acid, or it's a vinegar-like solution that helps us to see the abnormal areas on the cervix. And instead of doing a pap smear, one can just go right ahead and provide the treatment that is cutting out a smaller portion of the cervix, removing those abnormal areas so that the woman has a reduced risk and only came for one visit, doesn't have to get an HPV test, doesn't have to get a pap smear. It's just called the see and treat methodology, a visual inspection using the acetic acid. And so providers from here in the US go from our society and help to provide that service. As an individual, I think being aware of it and just heightening the awareness in our own country, not only because the HPV vaccination protects against cervical cancer, but because HPV is known to be the causative agent in a number of other cancers. It protects against vaginal cancer, it protects against vulvar cancer, it protects against anal cancer, it protects against mouth and throat cancer or oropharyngeal cancers. So knowing that HPV offers so much, here it would be good to speak to your colleagues, your friends, let them know, and then the knowledge that you have locally as you look into the various organizations that help. There are a number of organizations that are actively working from the United States to help reduce the cervical cancer burden globally. The Bill and Melinda Gates Foundation was one of the big ones who's contributed quite a bit of resources. But there's another organization, the PATH organization, who's actively working on that. And I myself am working on a company, a medical device company, to help in the reduction of cervical cancer on a global scale. So just Googling these various companies and in whatever way you can support them, that support will help on a global scale.
So more to come on your company and how that'll help to reduce cervical cancer. So with a few minutes and some time left, I'm going to just open it up for some questions.
Okay.
What are some of the testing that you should do if you think you may have cervical cancer?
That's a very good question. So if a woman thinks that they may have cervical cancer, the number one thing is make the appointment with your provider. Let your provider know the signs and symptoms that you're experiencing. Review with them whatever prior testing has been done, and then request repeat testing. So your provider will let you know if you have not been screened recently, then certainly they're going to do a routine examination in the office or in the clinic setting where they can actually look at the cervix. And if they actually see something, so usually if it's in the early stages, the cervix looks normal, and we just take a brush and take samples and send that to the lab, and under the microscope, they'll see if the cell is abnormal. But if it's further along and the woman is having symptoms, oftentimes you can see the abnormal changes already on the cervix with the naked eye. And so the provider can actually take a sample, or what's called a biopsy, or a pinch of tissue from that abnormal area right on that same visit, and send that to the lab directly so that you can get a diagnosis as quickly as possible. And then, depending on what that result is, be offered the appropriate treatment.
So another question, if somebody started their HPV vaccinations and maybe only got 2 of their 3 vaccines, do they have to start the whole series over?
No, they don't. They simply have to get that third dose. And
So it doesn't matter the interval of time.
No, you do not need to start the vaccination series over again. As long as it's more than 6 months from your second dose, then the timing is appropriate for the third dose. Even if it's a year later, you just need that one shot.
Okay, excellent. And you mentioned something about see and treat. Do we ever tend to do that here at all in the US?
We don't necessarily do it routinely, but that is a possibility. If an individual, if a provider, uh, oftentimes when the woman comes to the office, depending on how the office is set up, the provider may not have the capability to offer that treatment right then and there. And typically, uh, because we have the availability to do uh, more broad testing so that we can assure what stage it is and identify other factors to help reduce the risk of there being untreated disease, we take the time and the opportunity to take a step back and do things in a different way. So typically here in the US, the woman would have had a pap smear to identify or a biopsy that identifies that she has a cervical cancer. So typically, if you were to go to the office and there's an obvious lesion on the cervix, or if the individual, so usually when the woman has that vinegar put on the cervix, it's because she's already had a pap smear that led her to need the secondary biopsies. So we don't typically in our system just send women to get the special biopsies without first having done the pap smear, because we do have the screening available. So,
To address our younger audience, do you need parental consent to get the HPV vaccine?
so that's a very good question. And I do not believe, and maybe you can correct me, but I do not believe that parental consent is required for it. But you can.
If I'm not
I
mistaken,
believe
I
actually
believe-
they do need it. Yeah,
I'm not sure, but I do know that they offer it in some of the city areas within the high schools. But I'm not sure if they have to have consent to get it. But I know some of the schools that have some clinics within the school for contraception and contraceptive use, and not basically screening because they can't screen, can provide it, but I do think they may need parental consent, because I know there are some families that are concerned about vaccine. However, young people are concerned about preventing things in the future. So that's always a sticky subject that comes up as far as questioning.
Yeah.
And repeat?
No, I'll definitely double check that, but I believe that you're right.
So another question that I have is, if somebody, I know you talked about sometimes foul smelling discharge, and postcoital bleeding. Is there any kind of other discharge that people should look out for? Any particular color? Anything different?
Not necessarily. It could be a watery discharge, or it could be a malodorous discharge. So it could be without color. It could be blood tinged. It could be a bloody discharge. But knowing that it's not what is expected, it's not the norm. Anything out of the ordinary, you should always just go and have your provider evaluate you, just to see whether or not is it an STD, is it a non-STD vaginal infection, or is it anything more serious?
Understood. And what would you tell a patient that may have genital warts? Because we talked about HPV, and that's warts. HPV are the same kind of warts, but a different type of virus. How do you tell that patient, if you grossly look at the cervix and you see genital warts on the cervix, what do you tell that patient?
Right, so good question. So genital warts, one can see on the external genitals, on the skin. You could see warts, or what we call condyloma, on the vaginal walls. So these oftentimes are from an HPV virus type that is not cancerous. And the good thing about the HPV vaccine, so there used to be two different HPV vaccines made by two different manufacturers. But now in the United States, over the past few years, it's only been one vaccine that's available for everybody. And it's the one vaccine that we're using. It's called Gardasil 9. And so it covers 9 different HPV types. 7 of them are cancer protective, and 2 of them are for non-cancer HPV types that lead to genital warts. So when a woman is thinking about, or a young man is thinking about their risk for HPV, just knowing that this will protect them against non-cancerous issues too, such as the genital warts, is pretty significant. But the warts, genital warts, are typically not cancerous and are easily treated. Sometimes they'll regress on their own, or medication can be prescribed by your provider, or they can be physically removed through various surgical procedures.
Excellent. So I'm going to look to see if we have any more questions in our chat. And as we're coming to the close of our show, I want to thank you, Dr. Jackie Ford, for being part of our Empowering Women series for this month, especially talking about cervical cancer, which again is a cancer that we can prevent, especially with early detection. So we are looking forward to hearing back from you regarding your medical device and how that's going to have an effect on decreasing down cervical cancer. And again, you made a major impact on our women, including our men, our young men as well, talking about the HPV vaccine and how we can decrease cervical cancer for all women from a young age through adulthood. So thank you again for joining us on Empowering Women and Making a Change and All About Us Media. Thanks again, Dr. Ford.
Thank you for having me.
Thank you.
You're listening to All